Hi guys, this is Randy Vawdrey with the Mind for All Seasons. I'm with my good friend Robeson Flynn, who's the memory coach at the summit at Sunland Springs. And you see he's got this goofy contraption on, but there's a medical reason for this. There is more and more research that supports the benefits of red and near-infrared light, which is a very narrow spectrum of frequency of light that can stimulate the brain. It's called stimulation therapy. And we've learned about other devices, transcranial magnetic therapy, pulsed electromagnetic frequencies. This is just another form of that therapy using a light. Now this particular device is called a Vielight. All of the individuals that participate in the enhanced protocol, we encourage them to get on this device for about 30 minutes. This probe that Robeson's got stuffed up his nose is not just for discomfort, but it actually shines light right into the inferior aspect of the frontal temporal lobe, and it has some coordinating efforts between the olfactory nerve and the hippocampus. Now the hippocampus is the part of our brain that's directly responsible for memory formation. So anyone that's got dementia receives some benefit from this. You can look it up on the internet. It's called the Vielight, V-I-E-L-I-G-H-T. And this is not the only form of red light therapy that we have. There's other forms as well. But this is just a nice form that can be done in an office visit when someone's reading or waiting. Typically a session lasts for about 20 minutes, and this light pulses at about 10 to 40 hertz, depending on what setting it's placed at, to help stimulate the brain. So the benefits between red and near-infrared light on our brain is specifically an anti-inflammatory. It increases cerebral blood flow, it works as an antioxidant, and it stimulates an enzyme inside mitochondria called cytochrome C oxidase that increases the production of ATP. This technology is not new. It's been around since the 1960s, originally studied by Dr. Mesner, who is a Hungarian physician working on cancer treatments. So the technology has been around for a long time. But I think these types of technologies just get forgotten because we live in such a pharmaceutical era that we just go to the doctor to get a prescription. But mind, we want you to come see us, come join us, come participate in our memory clinic. We are one of the first assisted living centers that has an outpatient therapy for people who don't want to go live in assisted living but are starting to have some cognitive disorders. Robeson helps direct that clinic and I oversee it. And in addition to that, these are therapies that people who live in assisted living or memory care can also participate in under very specific circumstances. So once again, we're at the summit at Sunland Springs. Come check us out and learn how to protect your brain.